Hi, my name is Dr. Mark Clapper and I'm an orthopedic surgeon. In this video, I will be discussing some of the things that can go wrong in the spine. Each level in the spine has several structures that start to fail as we age or that can be damaged with certain trauma. For younger people, this is most commonly disc hernias, often called ruptured discs. The discs are in front of the spine, between each vertebra, seen at every level, and they're exposed to enormous pressures in normal life, not to mention athletic events, trauma, and work situations. Sometimes the annular ring structure at the disc level can fail, and this failure allows disc material, seen here as a red dot, to escape outside the fibrous ring and move backwards toward the nerves. This disc hernia can squeeze a nerve root, causing sciatica or pain down the leg, or with a hernia in the neck, this pain is felt down the arm. In certain situations, the disc material can actually push up against the spinal cord or the filaments of the cauda equina, depending on the level of the hernia. The most common event is that a nerve root is compressed by this out-of-place material. This compression can cause searing pain that travels down the arm or the leg in the distribution that that specific nerve provides function. The pain can be accompanied by weakness of the muscles that are controlled by that nerve or numbness in the area that that nerve senses. Most disc hernias resolve over time as the material that escapes the spine loses its supply of nutrients and effectively dries up and shrinks. This does not happen in every case, but it does in the majority of cases. As people age, disc hernias become less common, but a different set of problems begin. All of the connections in the joints of the spine are moving and wearing out. This wear and tear can result in the joints becoming arthritic and developing bone spurs, or what we call osteophytes. Most people are aware of their knuckles swelling and the joints in their hands and fingers stiffening. This is happening in your spine as well. Similarly, the disc material begins to collapse, decreasing the space between the vertebrae. Most of us experience this as we get shorter as we get older because of all these discs shrinking. Many of the passages that allow the nerves and small arteries and veins to exit the spine are now compressed by these enlarging joints, the bone spurs, and the loss of space between the levels. This type of compression can happen in both the neck and the low back, but almost never in the thoracic spine. As this condition develops, people will note that they can only walk or stand for so long, and after that time or that distance walking, they begin to develop pain or weakness in a leg or both legs, and sometimes in the back. If they sit down for a period of time or rest leaning forward, this pain will go away and they can get up and they can walk or stand again. You might know when you go shopping that there's lots of people, older people, walking, leaning forward on their shopping carts. They're trying to avoid the pain of their spinal stenosis frequently. Physicians call this condition spinal stenosis, and it is very common as we get older. These two problems, however, pale in comparison to the amount of back pain experienced in the population. The vast majority of people with back pain will not find a diagnosis or a verifiable cause of their pain. This makes the problem even more frustrating, as there must be something wrong to feel this bad. Most of the physicians who work in back pain is making sure that there isn't something wrong that is life-shortening or that can be corrected. These problems include infections, trauma, and tumors. So to evaluate someone with back pain, I will do a careful history of their overall health, looking for prior problems. For example, do they have a history of cancer? Is there presence of weakness or numbness? Where is the pain? Has that person had fever, chills, night sweats, or has there been unexplained weight loss? These things suggest to the physician, myself, or someone else that that person might have a tumor, they might have an infection in their spine, they might have tuberculosis. Next is a physical examination looking for neurologic deficits, numbness or weakness in a leg or arm, symmetry of the reflexes in the legs and arms, and other specific tests that help localize the problem. If there is nothing in the history that suggests a serious problem like an infection or a tumor, and there are no specific findings on the examination that suggest compression of a nerve or nerves, then there is little likelihood that a cause of the pain will be found. The old advice to rest in bed and not move has been replaced with the advice to get up and move and walk and avoid lifting, but do keep moving. For most people, the pain will resolve and not become a long-term problem. Without a history of trauma or some indications of infection or cancer, X-rays are rarely of value, but they do expose you to significant ionizing radiation. MRI is extremely good at showing us the anatomy of the spine, the course of the nerves, the quality of the discs, and so on. What it is not good at is relating what feature of your spine is causing the pain. In the past, there have been studies where pain-free patients were offered MRIs of their spine. These MRIs were then mixed in with MRIs of patients who were having problems with leg or back pain and were likely candidates for surgery. The radiologists reading these MRIs were not aware of which patients had or didn't have a pain problem. The result? Only 36% of the pain-free patients had a normal disc at every level in their spine. About half of them had a disc bulge at least one level, and a quarter of them had a frank disc protrusion or disc hernia. The results of this suggest that MRI can be meaningless when considered in isolation without physical exam findings and a history. So the MRI shows us lots of things, some of which are normal and some of which are not. But the question is always, is the finding on the MRI the cause of my pain? This is obviously a perplexing problem and widely debated. I will stop here. In the next section, I will discuss spine surgery in general terms.